And we're going to talk with a postpartum RN nurse, Kristen Kuhn, and she's going to tell us what to expect in the postpartum period. We talk a lot about, giving birth and everything and preparing for the birth, and we should talk about that. But the postpartum period is really important. And Kristen worked in postpartum for how many years did you work in postpartum?
6 years.
6 years. So she has a lot of knowledge. So we're going to ask her a couple questions and help you along the way know what to expect when you get there. So, Kristen, when do moms usually go over to the postpartum department after they give birth?
Usually they go over to postpartum. If they don't get it, there's different times that they go. If they don't get an epidural, then it's usually very soon after birth, within the hour, and they usually would like them to urinate. And as long as their uterus is doing okay and their bleeding's okay, everything looks good, then they send them over. With an epidural, you want to be able to feel your legs before you go to postpartum and also empty your bladder. And that's most important because a lot of times they use a Foley catheter after they give you the epidural because you can't get out of bed.
Okay.
And so they just want to, it takes a little bit of time for your bladder to wake up. So they just want to give you a chance to pee and make sure everything's okay as far as that's concerned. And again, as long as there's no major bleeding or anything like that, then they're going to send you because you're stable.
Okay.
If you have a cesarean section, you'll go. Usually after a cesarean is surgery. And so they have to make sure that you are stable. And even if you can't feel your legs at that point, they'll send you over after so much time of watching your vital signs and your bleeding and things like that, your incision.
Okay.
And then once you get to postpartum, you're going to feel like, oh man, I just left there and they just took my vital signs. I got my blood pressure checked and my oxygen checked. But the fact of the matter is that nurse is responsible for the information they get.
Right.
And they need to make sure. And things can change so quickly with a woman after she has a baby. It's the most natural thing in the world. God made us this way. However, on an occasion, something might happen to change things. Maybe the blood pressure will go too low. Maybe the blood pressure goes too high. Maybe all of a sudden that person's in a lot of pain and we don't know why. Maybe there's a lot of bleeding. All these things we can find out from the blood pressure, from the heart rate, and from their oxygenation.
Right.
So these are major things. And then we also have to do what's called a fundal check, and they will do those often, the postpartum nurses, that is. And they get less and less as you're in the hospital. But that first 24 hours is extremely important. One of the things they do, the fundal check, is checking your uterus. And the fundus is the top of your uterus. What they're going to do is they're going to press on the top. And what they're expecting is how low it goes beneath the umbilical, which is your belly button, and how firm it is. These things are important because if it's not firming up, then bleeding can occur. And usually bleeding occurs because maybe some of the placenta didn't come out. Maybe some of the, any parts of, from your birth, after birth can still be in there. Happens on a great occasion, your body didn't get rid of it, and something may happen, and that's called a hemorrhage. When a hemorrhage happens, it's usually like a lot of clots, usually bigger than a golf ball, and it's it's a lot. It's not a normal amount of bleeding you'd expect after a birth.
What will they do if that happens?
If this happens, there's many things they can do. One thing is to take you back to surgery and scrape your uterus, which is a very routine procedure, and that just gets rid of all the things that might not
Should
need
not
to
be
be or
there.
should not be there.
Hmm.
Then another thing is, and they make you comfortable for all of these things. This is not something that you're going to
Right.
pain
They're
through.
not going to suffer.
Sometimes all they have to do is give you blood, and they might have to put a balloon inside. The balloon holds pressure because there could be a tear very high up that nobody knew about, which is very common when you give birth.
Mm-hmm.
It's extremely common, especially when women choose not to have episiotomies. It can happen, or if you do choose to have episiotomy, it's nobody's fault.
Mm-hmm.
It just happens.
Right.
And the doctors, they get in there, and I mean, it's amazing what they do, but sometimes you can't see everything.
What else do they do for the bleeding besides maybe having to go back in?
Pitocin. They give lots of Pitocin. Sometimes routinely they'll give Pitocin to mothers that have had usually 2 or more births. And that's because your uterus is like a balloon. And if you have ever blown up a balloon, it stretches out
Mm-hmm.
every time you blow it up. And then you
Mm-hmm.
deflate it. And each time it stays a little bigger and a little weaker. The more you blow it up, there's weak spots. Well, your uterus is exactly the same
Mm-hmm.
because your uterus is a solid piece, solid muscle organ, about the size of your fist. And that, when the embryo attaches, that stretches out. It's amazing when you see a pre-pregnant uterus and then all of a sudden it just thins out and just becomes a house for a human being.
Mm-hmm.
And so the more births you have,
Right.
it's like that balloon. It's going to have a little bit of weakness somewhere.
Okay. Yeah.
Most people don't have any issues, but some do. So sometimes you'll get the Pitocin anyway. And that's up to your doctor to decide one way or the
Right.
other if you need it or not.
Right.
But cramping is part of your uterus going back to normal. And I tell people pain is gain. That cramping, it is labor pains. It feels like labor pains, and it is labor pains. It's not as bad as while you're pushing the baby, but it is labor.
Right. Right.
And it is because your uterus is still working to get back to normal.
Mm-hmm. And we want it back to
And
normal.
we want it back to normal, yes. Because, like we said, if it doesn't get back to normal, there's things that can happen. And that includes bleeding.
Mm-hmm. So they'll be doing the checks on the pads, how many pads you
want
have.
to know. Yeah, we want to know how many pads you went through in an hour.
Okay.
Or how often you're changing your pad.
Okay.
So it's pretty normal to go through one an hour,
Mm-hmm.
and it gets lighter and lighter and lighter. It's not normal to go through multiple an hour. They're big pads, but
Yeah.
nobody should be bleeding that much, especially if you had a C-section. There's not too much bleeding afterwards. And I know when my niece Debbie was born, she had a bleeding problem. You want to tell that story?
Oh, when Debbie had her baby, when Debbie gave birth to her baby, I was there. We had interviewed her previously, and she kept bleeding and bleeding. And I was actually on the phone with Kristen when I was talking. She said, "You need to get a nurse in there and get some Pitocin on board." And that's what they did. And stop the excessive bleeding. So it's not unusual for women to have, you know, get Pitocin after that. And it does help. My other daughter had the same problem,
Right.
excessive bleeding. I
Because
never had that.
she had a baby that just came fast. And sometimes that can cause tearing that nobody realizes you have, and that can cause problems.
Right.
So there's different things that can cause these problems, and usually, like I said, it's a good situation. It's not anything, you know, most things like this don't go wrong, but be prepared. They can go wrong. And but they're easy to fix as long as the nurses are able to do what they want to do or
Okay.
need to do rather.
Okay.
If you don't allow the nurses to do it, and I know you're so tired and it hurts and all of that,
Mhm.
but if you don't allow it, you're putting yourself in danger. And you just went through a beautiful experience,
Right.
and we want to keep it beautiful.
Absolutely. So when they're in the postpartum room and how often do you do blood pressure checks? Is that every 15 minutes, the first hour, or is it every hour?
Surgical would be the C-section moms, and then we have to follow the same protocol as if you had surgery, which is every 15 minutes for the first hour, then twice in an hour, it's every
Mhm.
30 minutes for an
Mhm.
hour, and then it's, once an hour, and then it goes down. For a regular postpartum mom, it's about once an hour.
Okay. And then you're checking, what are the things that you're checking besides the pads, the blood pressure? How long before they will walk if they had an epidural?
If they had an epidural, as soon as they feel their legs, we want to get them out of bed right away. But both legs need to be fully um,
Working.
working. You don't want a little bit of numbness. Believe me, I've helped people off the floor that thought they were ready to go to the bathroom. The other thing is you want to try to empty your bladder at least once an hour. And that's a big pain in the butt, but it also aids in not having a hemorrhage. It keeps you from getting an infection,
Hmm.
and it's just good all the way around.
So they might have to use a bedpan if they can't feel.
If you can't feel it, then you should ask for a bedpan or a bedside commode that somebody can help you to. Now they have new equipment that they can even get you to the toilet. I'm not sure how this hospital does it, but I know that in some hospitals they do have equipment that'll get you to the
Okay.
bathroom.
Okay. So, now we talked about the woman and what to expect there. Is there anything else they should know as far as their body and everything else before we talk about the baby?
Well, with their body, we want to make sure that their nipples are okay and intact because believe me, a nursing mom can get a blister so quickly if the latch is not correct. So we want to make sure that you have a good latch all the time.
Mhm.
So, we'll always check your nipples.
You'll help them with breastfeeding if they're breastfeeding, and that's all you have. Okay. Now let's talk about the baby. The baby for the baby friendly hospital that we have at Shands, the baby room's in with the mom, and the hospital you worked at was the same thing.
Yes.
So, um, what should we expect as far as the interaction with the parents, the partner, the baby, and what is happening with the baby during this time when the woman is
Well,
being
during
checked?
this time, they always do a spot blood sugar check on your baby. If you do happen to have a blood sugar baby, they have to be checked once an hour depending on their blood sugar, depending on their weight, if it's because they're so tiny.
Mhm.
If you took insulin, if you took metformin, especially. Um, and some blood sugar moms don't take anything. They usually are able to control a diet, so that's not a big deal. And we have to have 3 good blood sugars. We do them once every 2 hours
For the baby.
for the baby, and
Okay.
then that's it. They're done. Now, if it's a baby that's too small for gestational age, then they're usually the ones that they actually have low blood sugars when they're born. And, or I shouldn't say usually, but sometimes have low blood sugars when they're born. And we have to keep an eye on their blood sugars because they're so tiny. Their bodies are not handling being outside the womb um, as fast as we'd like them to. They don't have a lot of that fat on their body, that the brown fat that helps feed them after they're born. So those babies go from every hour to every 2 hours, depending on how well their blood sugars are in the beginning. And they go for a full 48 hours, 2 days. If we get a baby that their blood sugars end up not, if they have one bad blood sugar, I don't care what stage they're in, larger than gestational age, they're also 3 good blood sugars and they're done. And they are blood sugar babies. But no matter what stage they're in, of any of the 3 I talked about, if they get one bad blood sugar during that, it starts all over. And a lot of parents get annoyed and it's heartbreaking. It breaks my heart too. I don't like sticking a baby's heel. But if it's done right, it really doesn't hurt them.
Now, can we ask you a question about the skin to skin after? Because we talked a lot about the skin to skin after birth. This helps with the blood sugars.
Skin to skin helps with the blood sugars for sure.
And if you're feeding the colostrum,
they only need a little bit. It's the smallest amount. It's just if you have a sugar baby, you want to feed them as often as maybe once an hour, once every 2 hours.
Okay.
That way, they're getting what they need. Everybody's happy. Also, the skin to skin, it helps their heart rate. It helps their temperature, their respirations, and like you said, their blood sugar. I mean, it's amazing. But something like that people don't understand, they think it's, oh, I'll do it because I like it. The baby's nice and warm, but they don't realize that's something. It's like if you take a cake out of an oven and try to cut it right away, it crumbles, right? Well, the baby just came out of the oven.
Yeah.
And we want the baby to have a chance to cool down.
Right.
Well, not really cool down, but you know what I mean.
Regulate.
Regulate.
The systems regulate.
Right.
So what else should we expect with the postpartum period and the baby? What other things are they going to be doing? Maybe not right away, but in the first 24
Usually
hours.
in the first 24 hours, they'll sleep pretty good, mostly the first 12 hours. But then they start waking up and they start getting hungry.
Mm-hmm.
And you think to yourself, the first 24 hours, oh, I've got the best baby. Then the second 24 hours, what's wrong? What am I doing wrong? She won't eat. Because all of a sudden they're starving. They've realized they're no longer being fed without having to do anything. Look, they got their food for free, the rent for free. They were warm. Yeah. Everything was in there, contained inside mommy. And now they're on the outside. Now they got to work for their food. They don't like it. So you've got to teach them to like it. Yeah. So it's hard and it's nerve-wracking. That's where the partner really can help by encouraging the breastfeeding, if that's what you choose to do. Right. By encouraging that, by helping, even putting the breast in the baby's mouth for mom. Especially after a C-section, these moms are in pain, it's not a joke how much pain they can be in. So you want to make sure that you are supportive partners, whoever you may be, the dad, the friend, the sister, the mother, whoever you are, you need to be supportive because that's going to help mom's anxiety lower. And when mommy's anxiety lowers, it helps her to feed. And it helps the baby to enjoy it more because they can sense everything. The thing is we want this experience to stay beautiful because what you did was a miracle. It was amazing. And there's other things we could go on forever, but the fact of the matter is this is the most amazing thing that you can go through. And when you breastfeed, it's the most amazing bonding experience. If you can't breastfeed, please don't feel guilty.
Right.
Sometimes we're not all connected the same way. Maybe your sisters did it great and your friends did it great and all of a sudden you don't. But sometimes it takes a couple of days. There's other ways to do this. So make sure that people help you with alternatives so that you can try.
Right. Absolutely.
And it'll come. If it's going to come, it's going to come.
Absolutely. So in this postpartum period, do you give any other advice before they, face the recovery postpartum time? What else would you say from your experience?
With C-section moms, I just want you to know that getting out of bed as soon as you can get out of bed, not before you're told that it's okay. Excuse me. I want you to know that is the best thing you could do is get out of bed as soon as you can. Get that fully out, get out of bed, try to urinate, and just keep trying. And that's going to help with the pain. The first time you put your feet on the floor, you might be cursing us all out. That's okay. But the fact of the matter is you're gonna live through this.
Right.
You will.
Okay, well, that's good advice. We're all going to live through this.
Something that I went through with a lot of moms, and I've never lied. I've always told them, yep, it hurts.
Yeah.
But it's not as bad as you think. Just breathe. Breathe.
Right.
And listen, because your nurse is there to help you. And if there's ever anything you want to question, ask. If there's ever anything that you're not comfortable with, say something. Because you ultimately know your body.